Welcome to today's Pharmacology quiz, part of our ongoing Pharmacology quiz series. In this video, we'll be testing your knowledge of insulin agents, the vital drugs used in the management of diabetes mellitus. The quiz features 10 multiple-choice, scenario-based questions, each designed to challenge your understanding and clinical reasoning. Every question comes with 5 answer options, followed by the correct answer and a brief explanation to reinforce key concepts. For a more detailed review of insulin agents, check out the companion teaching video linked in the description below. So, let's get right into it. Question 1. Mr. Anderson, a 55-year-old man with type 2 diabetes mellitus, presents with poor glycemic control despite maximal oral therapy including metformin and sitagliptin. His HbA1c is 9.3%, with normal being less than 5.7%. The clinician plans to start him on insulin therapy. Which of the following insulin preparations is the most appropriate to initiate as a once-daily basal insulin? Option A, insulin glargine. Option B, insulin lispro. Option C, insulin aspart. Option D, insulin regular. Option E, insulin degludec. The correct answer is option A, insulin glargine. The explanation is that insulin glargine is a long-acting basal insulin commonly used to start insulin therapy in type 2 diabetes. It provides steady 24-hour coverage with minimal peaks, reducing the risk of hypoglycemia. In contrast, insulin lispro and aspart are rapid-acting insulins used around meals, while regular insulin has a shorter duration and is not ideal as basal coverage. Insulin degludec is also long-acting but is usually considered after experience with glargine. Question 2. Mrs. Johnson, a 32-year-old pregnant woman with gestational diabetes, is unable to achieve adequate control with dietary measures. She asks about starting insulin and the safest option during pregnancy. Which of the following insulin preparations is not recommended in this clinical setting? Option A, insulin lispro. Option B, insulin aspart. Option C, insulin detamir. Option D, insulin glargine. Option E, insulin regular. The correct answer is option D, insulin glargine. The explanation is that insulin lispro, insulin aspart, insulin detamir, and insulin regular are considered safe and effective during pregnancy. Insulin glargine, however, has less established safety data in pregnancy and is generally avoided. Studies have shown reassuring results for lispro and aspart due to rapid onset and predictable profiles. Regular insulin and detamir are also accepted, making glargine the least suitable choice in this scenario. Question 3. Mr. Harris, a 64-year-old man with type 1 diabetes, presents with episodes of hypoglycemia during the night. He is currently taking NPH insulin at bedtime. His physician considers switching to a basal insulin that provides smoother 24-hour coverage with less risk of nocturnal hypoglycemia. Which insulin is the most suitable replacement? Option A, insulin glargine. Option B, insulin regular. Option C, insulin lispro. Option D, insulin NPH. Option E, insulin aspart. The correct answer is option A, insulin glargine. The explanation is that insulin glargine provides flat, prolonged basal coverage, significantly reducing the risk of nocturnal hypoglycemia compared with NPH insulin. NPH has a pronounced peak that often causes nighttime lows, which is problematic in type 1 diabetes. Insulin regular, lispro, and aspart are rapid or short-acting insulins designed for mealtime glucose control rather than basal coverage. Therefore, glargine is the most suitable replacement to minimize nighttime hypoglycemia. Question 4. Mrs. Wilson, a 71-year-old woman with long-standing type 2 diabetes complicated by chronic kidney disease with an eGFR of 25 ml per minute, is switched from oral agents to insulin therapy. The clinician considers pharmacokinetics in renal impairment. All of the following statements about insulin in renal failure are correct except
Option A, insulin clearance is reduced in CKD. Option B, insulin dose requirements may decrease. Option C, insulin sensitivity improves in late CKD. Option D, all insulin analogs are contraindicated in CKD. Option E, risk of hypoglycemia is increased. The correct answer is option D, all insulin analogs are contraindicated in CKD.
The explanation is that insulin clearance is indeed reduced in chronic kidney disease, leading to prolonged action and lower dose requirements. Patients in advanced CKD often become more insulin sensitive due to reduced clearance of endogenous insulin. This increases the risk of hypoglycemia, which is a well-known complication. Insulin analogs are not contraindicated in CKD, making option D the incorrect statement.
Question 5.
Mr. Robinson, a 23-year-old man with type 1 diabetes, is admitted with diabetic ketoacidosis, also known as DKA. He is dehydrated, tachycardic, and his blood glucose is 38 millimoles per liter, with normal levels being 3.9 to 6.1.
Intravenous insulin infusion is required. Which of the following is the insulin of choice for intravenous infusion in this emergency? Option A, insulin lispro. Option B, insulin glargine. Option C, insulin regular. Option D, insulin degludec. Option E, insulin detamir. The correct answer is option C, insulin regular. The explanation is that intravenous insulin infusion in diabetic ketoacidosis requires a predictable, short-acting insulin. Regular insulin is the only insulin approved and widely used for administration in emergencies. Rapid-acting insulins like lispro and aspart are not typically used intravenously in DKA. Long-acting insulins such as glargine, degludec, and detamir are inappropriate for infusion due to delayed and unpredictable action. Question 6. Ms. Thompson, a 46-year-old woman with type 2 diabetes poorly controlled on glimepiride and metformin, is being considered for insulin therapy. She is worried about weight gain. Which of the following insulin regimens is least likely to cause significant weight gain? Option A, pre-mixed insulin twice daily. Option B, basal bolus regimen with NPH and lispro. Option C, once daily insulin glargine. Option D, intensive sliding scale insulin. Option E, twice daily regular insulin. The correct answer is option C, once daily insulin glargine. The explanation is that basal insulin regimens, such as once daily insulin glargine, are associated with less weight gain compared to premixed or basal bolus regimens. Insulin glargine provides stable coverage without frequent peaks that stimulate appetite or cause excess caloric storage. In contrast, premixed and sliding scale regimens increase weight gain due to frequent hypoglycemia and compensatory eating. Twice daily regular insulin is also more likely to contribute to weight gain. Question 7. Mr. Davis, a 35-year-old man with type 1 diabetes, has been experiencing frequent postprandial glucose excursions despite good fasting glucose levels. He currently uses insulin glargine once daily. His endocrinologist decides to add a rapid-acting prandial insulin. Which of the following is not a rapid-acting insulin suitable for mealtime administration? Option A, insulin lispro. Option B, insulin aspart. Option C, insulin glulicine. Option D, insulin regular. Option E, insulin inhaled, also called technosphere. The correct answer is option D, insulin regular. The explanation is that insulin regular is a short-acting insulin, not a rapid-acting one. It has a slower onset of action, which makes it less ideal for controlling sharp postprandial glucose rises. Rapid-acting insulins such as lispro, aspart, glulicine, and inhaled formulations act quickly to cover meals effectively. Therefore, insulin regular is not classified as a rapid-acting prandial insulin. Question 8.
Mr. Clark, a 59-year-old man with type 2 diabetes and hypertension, is treated with insulin therapy. He recently developed frequent hypoglycemia after his cardiologist added a new drug. Which of the following medications is most likely to mask adrenergic symptoms of hypoglycemia such as tachycardia? Option A, lisinopril. Option B, amlodipine. Option C, propranolol. Option D, hydrochlorothiazide. Option E, losartan. The correct answer is option C, propranolol. The explanation is that propranolol, a non-selective beta blocker, can mask adrenergic symptoms of hypoglycemia such as tremor, palpitations, and tachycardia. This makes hypoglycemia harder to detect and increases risk for severe episodes. ACE inhibitors, calcium channel blockers, thiazides, and ARBs do not significantly blunt adrenergic warning signs in the same way. Therefore, propranolol is the agent most likely to hide hypoglycemia symptoms. Question 9. Mrs. Martinez, a 65-year-old woman with long-standing type 2 diabetes, has difficulty remembering multiple injections and asks for an insulin regimen requiring the least frequent administration while maintaining efficacy. Which insulin preparation is most appropriate? Option A, insulin NPH. Option B, insulin lispro. Option C, insulin degludec. Option D, insulin regular. Option E, insulin aspart. The correct answer is option C, insulin degludec. The explanation is that insulin degludec is an ultra-long-acting basal insulin that provides over 42 hours of glucose-lowering effect. Its long duration allows flexible once-daily dosing and minimizes the need for multiple injections. NPH and regular insulin require more frequent dosing, while lispro and aspart are rapid-acting and not suitable for basal coverage. Therefore, insulin degludec best suits patients seeking fewer injections with reliable control. Question 10. Mr. Walker, a 42-year-old man with obesity and type 2 diabetes, has persistently elevated fasting glucose levels despite maximum basal insulin titration. His endocrinologist considers adding a non-insulin injectable agent that may aid in weight loss. All of the following non-insulin agents may be considered in this setting except Option A, exenatide. Option B, liraglutide. Option C, dulaglutide. Option D, pramlintide. Option E, pioglitazone. The correct answer is option E, pioglitazone. The explanation is that pioglitazone is a thiazolidinedione that typically causes weight gain, not weight loss. In contrast, GLP-1 receptor agonists such as exenatide, liraglutide, and dulaglutide promote weight reduction along with glucose control. Pramlintide, an amylin analog, can also contribute to modest weight loss. Therefore, pioglitazone is the exception and not a suitable choice when weight reduction is a priority. Conclusion. That wraps up our revision on insulin agents, completing this engaging pharmacology quiz. I hope you found the questions both challenging and helpful in reinforcing your understanding of this essential topic. For deeper learning, consider exploring Katsung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, for up-to-date therapeutic guidance. Remember, all guideline references mentioned in this video are based on the BNF standards. Keep pushing forward and continue strengthening your pharmacology knowledge. Every step brings you closer to mastery.